I'd like to talk to you today about a new pain treatment program now available in Pennsylvania. We have mobile nurses now available to come out and treat you in your own home. For specifically right now, we are promoting the aspect of a neuropathy pain treatment. So with a neuropathy pain treatment program now available in your home, makes everything a lot easier for everyone. So I want to talk to you a little bit about what the treatment is and how it works. Obviously, neuropathy is a major pain issue. A lot of patients out there, if you're watching this, you know exactly what this problem is. Pain and burning, tingling, numbness in the peripheral, extremities, typically in the legs and feet. And neuropathy is something that occurs over many years, decades, to develop and then to persist. And it keeps getting worse typically for most people. But it's an actual chronic pain issue. And if you're looking at this from the aspect of pain doctors and internal medicine, family practice doctors, all of these kinds of physicians have a hard time treating this pain issue. They can prescribe medications. There are very few other options, very few interventions. Really, it's just a very difficult issue, and that's why we're excited to be able to offer this. I think around the country, one of the most effective, or practically, to my knowledge, practically the only really effective treatment for neuropathy that's actually safe for people is what we're talking about right now, which is neurofunctional pain management. So, neurofunctional pain management is it's a combination of three things. You've got electroanalgesic therapy, an IV nutritional hydration, and health coaching. So I'm going to go over all three of those for a moment here. But I want to mention too that there's a reason why you probably haven't heard of this. I created this program back in 2018 to be a treatment program that operated in doctors' offices. And I worked with a lot of doctors, dozens of doctors all over the country for this. But what I've noticed is that in this treatment cycle, as you'll learn here in just a moment, it's not terribly convenient for doctors to operate this program out of their office. Most offices just aren't set up for this. There's a lot of time and effort needed to actually work do this therapy, and most pain doctors either just have too many patients. They have too many patients to handle. They're just inundated with patients to try and treat. A lot of doctors are limited to only a few minutes with a patient, and they order a script. A lot of doctors are converting a lot of their work over to interventional procedures. So their whole objective now is to get patients into the system for spinal injections and epidurals and all sorts of other interventional procedures, and then also surgeries and implants for pain. And that's really where everything's going now that the opioid crisis has actually caused so many problems, and prescriptions are much more difficult to manage as far as pain goes. But that being said, what we're doing here is actually amazingly effective for neuropathy, and it's now available in a mobile program so the nurses can come out and actually treat you in your home. So, electroanalgesic therapy. It's high pulse electrical therapy. It's extremely effective at treating pain. Some people are very receptive to it. I should qualify that. Most people have great success with this. There's a handful of people where, for some reason, their physiology just is not very receptive or responsive to the therapy, and they don't have a lot of success. But there's a lot of people with great success. So, speaking of that, the average success rate we've seen in this program in neurofunctional pain management, the average success rate is 85% success, and that is a statistic or a number taken from talking to all the different doctors we've worked with and asking them, "Hey, doctor, what do you think is the average success rate of your treatment program in your office?" Yeah, I believe 85%. That's what they'll tell us, and they're considering that. And when I ask them specifically, okay, well, now what do you think it is for neuropathy? Just considering all the patients you've treated for neuropathy, what do you think that is? Oh, yeah, it's more than 85%. It's probably 95%. So a lot of doctors we've talked to will openly agree that neuropathy specifically is more successful in their offices in the treatment program. So electroanalgesic therapy, it is producing high pulse electrical currents in that local area. It's depolarizing pain neurons, it's stimulating neurons and nerves. It is producing what's called, like I said, depolarization, which is uh, it's limiting or inhibiting the signal from the pain nerves to the brain to help reduce the pain inflammation cycle. So most of you are familiar with that inflammation creates pain, pain triggers inflammation, and you have this cycle that occurs. And so chronic pain patients have this chronic pain inflammation cycle that's occurring. And a lot of pain management efforts are trying to reduce inflammation. That's really what the objective is. Let's get rid of the inflammation and get rid of the pain. Um, Electroanalytic therapy actually is amazing at reducing inflammation and pain. So works extremely well, but it is a cumulative therapy. And this is something that this is the reason why a lot of doctors aren't, jumping all over using this in the office. You can see now, if you could do one thing for a patient one time and have some pain relief, that's what you'd probably want to do. So that's why you see a lot of these procedures, interventional procedures, injections, or a surgery or something like that. Let's do this one thing and treat pain and see how long it lasts. Electroanalytic therapy and neurofunctional pain management is a program, is an 8-week program where you're being treated twice a week in your home for an hour. Now you can easily do the math on that. Do you think most doctors' offices could even handle you being in their office for an hour twice a week? It just doesn't really work. They just don't do that. And despite a lot of doctors knowing what this therapy is and knowing that it works, they still don't have time to really deal with it, to engage with it. And so that's where, over the years, what I've noticed too is that despite doctors that did have the program in their office, the other problem they had is patients being able to get to them, right? So coming in twice a week for an hour, you as a patient know that might not work, right? Marketing and talking to patients for this over the years. And so many patients, probably I'd say probably close to half the patients we came across or talked to out in the open market, just talking to patients here and there. Um, Probably about half of them couldn't even make it into the office or commit to doing this in an office like that and getting that travel and transportation. And if you are in significant pain, you don't feel like getting around and doing that. So having the nurse come to you and treat you in your home is a major advancement in this program. And that's why I feel like it's going to be a tremendous benefit for everyone suffering from neuropathy and especially in Pennsylvania, where we're talking about right now. So that being said, the electroanalytic therapy is part number one. Part number two is the IV nutritional hydration therapy. Over the years, we have met doctors who were doing a variety of different things. When I first started this program, I talked to several doctors who were doing versions and varieties of electroanalytic therapy, mixing it with other things. What I discovered through thousands of patients of treatment over the years is that if we combined the electroanalytic therapy with the IV nutritional hydration in the same program, we had this amazing synergy effect. And this is how we're getting that 85+% success rate, is that we do one of your electrical therapies each week has a concurrent IV that occurs, nutrient hydration IV. So most chronic pain patients are chronically dehydrated. Most of them have chronic nutritional deficiencies, different vitamins and minerals that they are missing or lacking. All of those things, dehydration, lack of minerals, all those things, those do contribute to the pain issue, right? So you're looking at this being more than just a pain issue. You've got, physiologic, problems that are making it worse, right? Everybody knows this happens, right? If you have pain and you have some other issues going on with your body and other medical issues, makes the pain worse, right? So everyone knows that. But we've discovered that if we combine these two therapies, patients will have a stronger success rate. So getting more out of pain than potentially otherwise without the IVs. Having a faster onset of relief. So whereas, say, we know patient A started having success after 2 weeks, patient B with an IV was having success after 1 week when they included the IV, something like that. We started seeing patients get better faster. And then we saw a longer duration. So I should have mentioned this earlier, but the duration of this is actually probably what makes it most exciting for people. If you go through the 8-week program, historically, after thousands, maybe even tens of thousands of patients we've treated, historically speaking, we expect them to go for 3 to 6 months, somewhere in that range of pain relief. You talk to any pain doctor out there, if you can get 3 months of ongoing pain relief after anything that you do, that's a huge success, a huge win for the patient. 6 months, amazing. A year, that would be practically a miracle in a lot of cases to have a whole year of pain relief after being in pain for decades. but that has happened. We've had patients who have gone as much as a year. Maybe they still have some pain coming back toward the end of that year. One patient in particular that I remember came into the office to tell us that it had been just over a year since he had gone through the program and was just now starting to have pain come back. So great to hear that, but it lasted him quite a long time. Not every patient has such a long outcome, but even just a few months would be amazing for most patients to do the program, complete the program, and have a few months of ongoing pain relief afterwards, and in addition to health improvements along the way. All of that just makes everything better. So the third component of this is health coaching. Our nurses are going to go over this with you. They'll go over all of the different aspects of health. Most patients, once they're getting out of pain, there's this upward trajectory of success. So once you start getting out of pain, you want to continue to improve everything. So suddenly now you're interested in eating better, getting more exercise, getting better sleep. All these things start happening. Everyone starts improving. All of their other health metrics start improving. The health coaching is a great part of that too. So we include that in there as well. So those are the three things. So I mentioned in the title of this video that this is covered by Medicare. So yes, it is. All of this, everything we're talking about here is covered by Medicare and commercial payers. And the nurses can actually deliver and administer this treatment and this therapy program in your home as a mobile treatment service. So the RELATYV Mobile Pain Treatment Program is what we're promoting all over the country now for people that have neuropathy and a range of other chronic pain issues. But specifically today, we're talking about we just now have mobile pain treatment service for neuropathy in Pennsylvania. So we're excited for all of you there to actually get this treatment. I have a link in the description for you to go take a look at our site and also to fill out the insurance form. Despite us saying, yes, it's covered by Medicare and commercial insurances, we still need to do the insurance check to see what you're looking at. Like, what's your current plan actually, allowing and saying for these different therapies. Our team will take a look at that for you, see what your options are for treatment, and then our nurses can get ready to get out there and give you some treatment. So look forward to talking to you and to seeing you come to our site and check this out and get this started. We'd love to work with you and love to help you get out of pain. So thank you so much.